lungs are vital to living a full, healthy life, whether it means enjoying our children, playing sport, or simply hanging out with a mob. However, lung cancer is the most common cancer in Aboriginal men and the second most common cancer in Aboriginal women. This video aims to get people looking out for and listening to signs of lung cancer, so there will be more positive, better outcomes for individuals and families in our community. A family history of lung cancer, exposure to asbestos or past lung disease can increase the risk of lung cancer. However, the greatest risk for developing lung cancer is being a smoker or being exposed to the smoke of those around you.
The major risk for lung cancer is smoking. Smoking is the big ticket item, and prevention's by far the best approach.
Yeah. Just one more water. My mother died from emphysema, and yeah, it's really made you think about your kids, and I need to give up for them.
When we look at exposure to smoke which is not your own, smoke that other people are smoking, it's generally in an enclosed environment. It's in cars, it's in houses, and while the risk of lung cancer is associated with a cumulative lifelong exposure to smoke, it's all smoke. And the smoke that you breathe in, you don't know if it's your own or somebody else's, it still affects you.
I've tried 3 times to give up, and you know what? I want to smoke now. But I've got 3 kids, and that's why I'm doing it now. It's no longer for my own health, it is for my own health to see my kids around. Ah, thank you.
When people do address their smoking, and if they can go through the process of stopping that, their risk starts falling. If you've been smoking 30 or 40 years, it'll take 10 years from your risk to go from 22 times that of the non-smoking population down to only twice that. But that's a huge change. And the other really positive thing is, from heart disease point of view, as soon as you stop smoking, your risk starts falling almost from that week. So while people may have a lifelong habit, something that's been essential, they may have even enjoyed their cigarettes, to make that change, it's still got positive things at almost every stage.
When trying to detect lung cancer, some of the symptoms that you should look out for are shortness of breath, a cough that doesn't go away, coughing up blood, feeling more tired than usual, changes or loss of voice, unexplained weight loss. Most people with these symptoms will not have lung cancer, so one way or another, it is important to get yourself checked out.
A few months ago, I was on holidays at home and I had a really bad cough and my chest was really sore, and then I started coughing up a little bit of blood, which scared the hell out of me, because you see all the ads on TVs and you see people with cancer and things like that, and that's the first thing that came to my mind was lung cancer, because I smoke.
People who may develop symptoms that could suggest the presence of a lung cancer develop a number of things, and unfortunately they're not specific to lung cancer. There's no particular symptom that somebody comes in and it just says, hey, you know, I've got this and could it be lung cancer? There are a lot of very general things. People develop a cough, and while smokers and other people may have a cough, it's a cough that continues. A cough that ever brings up material, particularly if there's ever any evidence of bringing up blood. Sometimes they can get pain and pain on breathing. Sometimes they just don't feel well. They feel a bit tired, they feel a bit buggered. Some people get short of breath. And other people may just lose weight and be unwell. Another thing that people can present with is maybe a change of voice, and that can be a sign of there being problems both in the voice box or further down, because of the mechanism of speech involves a nerve that goes all the way down to the chest and out again.
If you have any of the symptoms, just go straight in. Don't be scared, because it most likely won't be what you think it is, and the doctors will find out what's going on with your body and put your mind at ease.
Your doctor or Aboriginal health worker is there to help, whether it is to reassure you that you do not have cancer or to get you the best treatment possible. They will also know you better, so that they, as experts, might notice something important that you have not realised.
I put it off at first to go to the doctors. It was a few days, and then my lungs started to get worse and I coughed up a lot of blood. At first there was little bits of specks like in what I coughed up, and then it was a lot of blood. So I went to the health service, saw my doctor, and told him that I was scared that I had cancer, and he said, well, let's send you away for some tests, and it's probably not, it's probably just a chest infection. But I was still really scared. So we went that day and got an x-ray, and when I got the results, it happened to just be a chest infection.
If people have symptoms that make them concerned that they could have a problem with their lungs, and that problem, as we may have mentioned, can be with cough or pain or change of voice or coughing up blood or losing weight, then their first port of call will be generally with a general practitioner or an Aboriginal health worker. Certainly someone who has the ability to follow through and determine what is happening. Most people with a cough do not have lung cancer, but there are a small proportion of people who do, and it's about finding them and finding them early, because the outcomes with lung cancer depend upon the type of cancer, but also how early it's found. And generally, while there is no adequate screening process that can be done, investigating symptoms early is where you get the better stories. If I was seeing a patient who was coming to me with any of those symptoms that we've mentioned, then I would want to investigate and find out why that's happening. That involves talking to people, getting a clear idea of their symptoms, examining them, and investigations. If someone was showing any signs of an abnormality on chest x-ray, it's important that we identify exactly what is there. That will generally involve further investigations, often with a CT scan of the lungs, often a thing called a PET scan, which is actually quite critical in finding out just what is happening. But ultimately, the way that a lung cancer is diagnosed is we need to get a piece of it. Those things sound scary, but it's amazing how skilled people are at doing it and how well people can be prepared.
For anyone diagnosed with lung cancer now, there is plenty of help available to support you and your family through all the tests and the treatment processes. Detecting and treating lung cancer as early as possible increases positive outcomes enormously.
My name's Kelly Goldsworthy and I work for Mungabarina Aboriginal Corporation as the Aboriginal Health Promotion and Chronic Care Coordinator. If someone presented to me with shortness of breath and coughing symptoms and weight loss, I would recommend that they see their doctor. I would also let them know that I'm here to support them and attend appointments with them. Often the GP refers them to different specialists or to places where they need to have bloods done. Sometimes people find that they're unsure of what they're doing, so I would come in and support them and talk through if they weren't understanding what was happening. I'd be there with their journey basically. If they needed me to be there as they travelled along with their seeing specialists and having bloods done and seeing oncology and radiation therapy, I'd be there and I'd transport them if they needed transport. I'd also support them with any specialist gap payments, just to make their journey a lot easier for them, to make it as comfortable as possible. There's a lot of other stuff that goes on with people as well. It's not just their actual illness, you know, they've got things going on in their life that also impacts on them not attending appointments and feeling as secure and safe as they'd like. We're able to draw on that as well as Aboriginal workers because we understand that it's not just one problem. It could be a lot of problems that are making the person feel that the way that they are feeling. There's also a lot of supports out there with cancer, so you've got your cancer nurses that could also provide information to the client on procedures and what's actually happening.
My name's Robin. I'm the cancer support nurse who supports lung cancer and mesothelioma patients. I usually meet patients at the doctor's consult or before that, or even after that. If they have an Aboriginal health worker with them, we can have a chat about what sort of services might be needed, whether they need further information about their cancer, how we can help link them into some of the cancer services and support services. Also providing, along with Aboriginal health workers and other colleagues, some education sessions to community. By providing education and information to health workers and community, we actually empower that community to seek services and ask questions. Having an understanding of what treatment is, it takes away the fear. It reduces the barriers to accessing treatment.